What's going on, Aces? Welcome back to the channel. This is the Married to Medicine Season 10, Episode 10 recap, a very powerful message. And there was a lot of powerful messages, the most prominent one being the, Black maternal mortality rate within the US. It's the highest in the industrialized world, and that's a huge issue. Unfortunately, Dr. Jackie is trending on social media because, a lot of people feel like her bedside manner and the way that she talks to her patients it's a bit problematic. And I agree, right? There was a comparative analysis side by side between the way that Dr.Heavenly, she was dealing with her patient. She had TS Madison. Simone had a patient and Dr. Jackie had a patient. And I'll get into the details. But comparing the three, one thing I will say about Dr. Heavenly and Dr. Simone, they are a lot more jovial with their patients. They laugh, and and they really try to put their patients at ease. Like I can see that they put forth that effort. Whereas Dr. Jackie, she's a lot more clinical in her approach. Um, and I feel like she reminds me, she has the bedside manner of a surgeon. You know what I mean? Like as opposed to a pediatrician or someone who, you know, um, should work toward making their clients feel as comfortable as possible. Well, let's go ahead and start where the episode begins, right? So it begins with Dr. Simone trying to explain to Toya that she actually does have a really good man. Like Eugene is a good man, Savannah, a good man, child. Okay, because Toya, baby, listen, okay, all these huge mansions and houses that we have seen throughout these past seasons of Married to Medicine, the fact that you guys are settled is, wonderful. Won't he do it? But now you're complaining about him not taking you out on different dates and things like that. Let me tell you something, okay? This man is a whole doctor out here. He's worked through COVID. He has, you know, um, he goes out and works, in hospitals and in the ER, which is extremely stressful. Okay. He has tried to, bend over backwards. We've seen Eugene like last episode, which I have to make a recap about that. But, he was cutting out, helping her take out her hair, which was really sweet. And, he said that it was similar to a suture. I think that's how they say it in the emergency room. But Toya just seems so, and a lot of people are saying quote unquote ungrateful. I wouldn't even say ungrateful. I would say complacent. Like I think she's bored, to be honest. And Phadrea called her a tennis pro. But I feel like, and I'm glad that she started her wine club, but I feel like she needs something more challenging in her life because I can only imagine, getting up in the morning, saving lives all day, every day in the emergency room, and then coming home to a nagging wife. Like, ain't nobody got time for that. So Simone is trying to tell her, listen, the reason why he doesn't plan more elaborate date nights is because you're critical of everything. And Toya has nothing but time on her hands. Baby girl, listen, your kids is in school 8 hours up, or not 8, child, Lord, but however long, from 8 to 2:30, whatever, you got all that time. You know what I mean? While you're playing in between tennis matches or whatever, plan the date that you want, but stop complaining, okay? Please. talking about, I gave birth, which is no small feat. She did give birth to 2 beautiful boys, but that was how long ago? 10, 12 years ago, however old the kids is. No, Toya needs to move on. Speaking of moving on, I will. So Dr. Jackie, she is trending right now. And she's talking to her patient about her health concerns. And I'm grateful because Dr. Jackie is competent. However, her talking about, the patient, she steps on some kind of new, measurement that measures your BMI or whatever. And according to Dr. Jackie, I think it's like her biological age instead of chronological. It comes out as 27, right? Which is fine. But here's the thing, Dr. Jackie, you have to factor in, that you are a business owner. You have high SES, high, earning abilities. In addition to, you might have the however they measure it, the biological age of 27. You're in your 60s. And I'm disappointed that she's not acting like that when she's talking to a patient and essentially shaming her for being overweight. You might not know if that has to do with, unresolved trauma or some kind of other medical issue that may not show up in the tests that you've run, in an OBGYN office. Dr. Jackie, I just need you to do better, baby, and just learn from this, because I'm tired of folks dragging you through the through the social media streets. I mean, I know she is as well, but yeah. Moving on from Dr. Jackie, I will say Dr.Simone and Dr.Heavenly, that's one thing I can say. I really enjoy how they talk with their patients in their bedside manner. Okay, Toya and Eugene take the boys to the dentist, which is really cute. And, I do like the fact that they communicate with each other well. So hopefully she can listen to Simone, cut him some slack, and, be happy that she has a wonderful husband who loves her and allows her to stay home to plan date nights and take their boys out to the dentist. And so the episode, goes into the ladies coming together for the very powerful message, right, concerning the Black maternal mortality rate. It's a huge problem, and I'm not a doctor, but what I will say is I'm friends with a lot of them, and this issue has affected everybody from Beyonce and Serena Williams to, Black women across the board. And until doctors look at Black women and honor our full spectrum of humanity, the problem isn't going to change. I feel like Jackie is, I don't know. I feel like she has a blind spot that that a lot of doctors have, which is anti-Blackness. And I don't know if she's even aware of it. And it may be, unconscious bias, non-conscious, all of us have a little bit of bias and a little bit of a blind spot. And until you actively do the work to decolonize the things that we've all been socialized and conditioned to believe about Black people, it's going to come out in ways that you might not even be aware of. So, and speaking of, what's Dr. Alicia's husband from Nigeria? He is, he is a piece of work. Okay. As opposed to Dr. Gregory, he's been very supportive and sweet tea in her journey with dealing with, endometriosis. And I feel like he's grown a lot since we saw his, initial marriage with Quad, which is great, right? Unfortunately, we have, in contrast, Dr. Alicia's husband. Y'all have to remind me of his name because it's escaping me right now. But he says, I'm from Nigeria, and where I'm from, the men are leaders of the household and they're leaders, which is fine. He's like, but if you're not leading, you're a weak man. And he basically emasculates all the men at the table, right? And Dr. Eugene, again, steps in and he says, well, women are still, right? The pay disparities there, they're still not making as much. They still don't have as much respect. And, Dr. Alicia's husband's like, well, yes, that's true. However, he continues on this really sexist, chauvinistic rant about how, women need to be more quiet and men need more of a voice, is what he essentially said. I'm glad that the older gentleman at the table told him that he was wrong, which he is. Dr. Alicia is a dentist, and I really hope you can see her kind of dim her light. Insecure men like that, nothing is ever good enough. Narcissists like that, he's giving Martell Holt vibes. Nothing that someone ever does for people, because that is an internal issue. I don't know if he's threatened by Alicia because she is a dentist or because he's Nigerian or whatever the case may be. But Dr. G, you're a psychiatrist, sit down with your and I'm so serious. Like, I'm laughing, but I'm dead serious. He has some issues and he needs help. So with that being said, you guys, let me know your thoughts on this week's episode of Married to Medicine. Please be sure to like the video, subscribe to the channel, and I will talk with you in the next one. Take care, Aces. Bye.